Hello, my name is Kate Fry, and I'm the Vice President of Advocacy here at New Futures. Today I'd like to talk about New Futures' campaign for a healthy New Hampshire. The 2022 legislative session has begun, and more than 45 pieces of legislation have been introduced that, if passed into law, would undermine our public health infrastructure like never before. Together, these bills would deeply impair our ability not only to overcome COVID-19, but also to prevent and address any public health crisis into the future. Some of the damaging bills that will be considered this session include HB 1035, HB 1210, and HB 1606. House Bill 1035, relative to exemptions for school vaccine mandates, would allow families to opt out of childhood vaccine requirements for school entry for philosophical reasons. Early childhood immunizations have been shown to be safe and cost-effective tools for protecting infants, children from potentially life-threatening preventable diseases such as measles, mumps, and polio. HB 1210, relative to exemptions from vaccine mandates, would require all private employers and colleges and universities to grant requests for conscientious exemptions for employees or students for all vaccines. Further, it would prohibit an employer from requiring vaccines for any medical treatment approved by the U.S. Food and Drug Administration only for emergency or experimental use. HB 1606, making the state vaccine registry an opt-in program, would weaken New Hampshire's registry for vaccines, a critical tool in increasing vaccination rates and combating infectious disease by forcing individuals to opt into the program rather than allowing them to opt out. Separately and together, these bills, along with dozens of other proposed this session, represent a significant threat to the health and wellness of New Hampshire families, communities, and businesses. Please join us in encouraging New Hampshire lawmakers to support the health and wellness of all Granite Staters by rejecting these harmful bills.